Hello, my name's Simon Thornton and I'm a GP here at Pioneer Medical Group in Bristol. So if you're new to teaching, sometimes it can be hard to get your head around how to organise teaching in the practice. Now, one crucial deadline to remember is May, and the reason is that in May the recruitment letters come out from the university to the practices, asking which years you would want to teach and how many groups you want to take. The way that we organise our teaching is that in April we normally send an email around to all the GPs asking who would be interested in doing student teaching. Once we've got all the replies back, we're then able to relatively quickly compete the information for the university about how many different groups we want to take across the course of the year. So we use EMIS Web, and we have a number of templates that we use for medical student teaching. So for example, we have a particular template that we use for teaching first years that our admin staff are able to upload when they know that we've got a student. We also have a template that we use for 4th and 5th year teaching when we have students sat in with us, which normally means a sort of 20 to 25% reduction in the normal number of patients that we would see, which for me normally means having 3 patients taken out of a 15 patient surgery as catch-up slots for having the students. One thing I've noticed is that every day we hear really interesting stories from our patients and see interesting clinical signs or get back lab results that really make us think. However, when you're trying to think of a patient who you might be able to bring in for medical students, perhaps the week before they're due to arrive, suddenly your mind can go blank. One way we've tried to get around that here at Pioneer is to create a spreadsheet of patients who would be suitable for medical student teaching. This is a spreadsheet we've created in an Excel document on a shared drive that is accessible by all doctors across all of our 3 sites. The spreadsheet contains information such as the patient's name, what condition they have, history and examination findings, whether they're suitable for a home visit or whether they need to come into they can come into the surgery. And also it includes the date when they were last seen for teaching. Crucially, one thing it doesn't contain is the patient's telephone number, which means that we still have to go into the patient's electronic record to get their contact number, meaning we'll be aware of any changes in the patient's circumstance. It means that when we see a patient in our routine surgery, we can ask them at the time whether they would be happy to come in to see medical students and then add them to our database.